got troubles and sorrows, but I wait till tomorrow. This is my taking.
This is Dr. Batts with the About That Life podcast, the podcast about life or living intentionally forever. And again, I couldn't do this without my new partner, my new team at TAAN TV, the African American Network. And again, our focus in this series is caring for the caregiver. Now, you've heard many of our shows where we've talked with individuals providing care, individuals delivering care, but today is a little different. Today, we talk with an expert in the field of various neurologic diseases that contribute to long-term care. Those conditions range everything from stroke to dementia to epilepsy, things that we see, that we know, but we really wanted to reach out in our community and find someone that not only had the expertise, but had the empathy to provide care and information for you today. Again, I'd be remiss if I didn't introduce and present to some my co-pilot, my co-host, my teammate, Mr. Williams. Sir, how are you doing today?
I'm doing mighty fine. Thank you.
Yes,
Thank
sir.
you so
Yes,
very
sir.
much. And I'm Derek Williams, and I am the founder and owner of Group Innovation and Diversity Training Associates, which is a multidiscipline consulting and training company focusing on individual, group, behavior with cross-cultural and racial perspectives. And I'm delighted to be here.
Yes, sir. Yes, sir. And I'd be remiss if, again, I didn't just highlight how TAAN TV has such a connection with the community that we are bringing to you this show to such a degree that we've brought an expert in. And this expert is someone that I had the pleasure of meeting recently, but her accolades, if I started to list them off, we'd be here all day. Internationally known, locally recognized, nationally accepted. I have with us Dr. Musa, who is a neurologist who specializes in epilepsy or seizure care, but really going to break down dementia and other things that require us to provide care. Dr. Musa, thank you for joining us today. Tell us a little bit about yourself.
Well, thank you for having me. So my name is Dr. Adetoun Musa. I am a neurologist. I also subspecialize in epilepsy, and I head the Kingdom Healing Institute. It's a private practice that is a practice that really focuses on holistic delivery of care and also rapid access to neurological care. I see all sorts of neurobehavioral disorders like dementia, Alzheimer's, things like Lewy body disease, Parkinson's disease, and we see some of the garden variety neurological disorders like migraine and epilepsy as well.
Wow. That sounds expansive, you know, and as a cardiologist, I get the privilege of telling folks the heart is super simple, right? It's only three things that can go wrong. You could have an issue with the structure, you can have an issue with the electricity, or you can have an issue with the plumbing. That's it, right?
Yeah.
But the brain, I remember in medical school going through the cranial nerves and then how
yes.
don't do that to me. But what we want to know, what the folks want to know is give us a little bit of insight, kind of a clinical discussion of dementia, what it is, how frequent, am I at risk for it? Let's talk about dementia.
Yeah, so dementia is an umbrella term, and it can include any diagnosis that affects your cognition. There's vascular dementia. And vascular dementia typically occurs when you have cardiovascular risk factors and you have a stepwise decline in your memory and your cognitive processes in general. You may be okay, and then suddenly you have a drop. It may be secondary to cardiovascular problems like TIA, hypercholesteremia, and other heart problems as well. Then there's Alzheimer's disease. Alzheimer's disease is a problem with protein deposition in the brain, like tau protein, for instance, and neurofibrillary tangles. It's something that you can see a doctor like myself for an official diagnosis, And typically it presents with sundowning, where the patient might be okay during the day, and then again their cognition will decline at night. They may have issues with illusions at night where they're seeing shadows, they become more paranoid. Short-term memory and executive functioning and planning really decline in Alzheimer's as well. But this particular diagnosis, the only way you can really confirm it is with tissue diagnosis, either from a brain biopsy or an autopsy when that person passes on. So there is a lot of detective work when you are suspecting maybe your family member has dementia, and it's important to go to an expert.
Yeah, and what I'll say is just in that space of dementia, and Mr. Williams, I'm going to want you to lean in here, is there's a certain, especially in our communities, but communities as a whole, stigma surrounding dementia and what that means. And I can tell you, even as a cardiologist, I don't say it until I've seen an expert say it. I'll use the term mild cognitive impairment or MCI because I know patients hold on to that, family members hold on to that. But in the African American community, can you talk about how mental health disorders, which dementia isn't, but how dementia is in some degree stigmatized?
Well, absolutely. And again, because of historical circumstances, many of the maladies that we experience have a stigma attached to it. It's unfortunate. We are often the first and the last. And in the area of medical situations affecting our loved ones, often we don't have the up-to-date definitions of what's happening. We have a combination of factors such as, well, dad or mom or big mom or whomever is sick, and we'll take care of it. And sometimes we're not able to take care of it. The idea that we have an obligation to take care, and we do have an obligation, but out of that, when we're not able to fulfill our responsibilities or the responsibilities that have been put before us, we develop a sense of guilt about not being able to do that. And of course, that creates a lot of family anxiety. And the social stigma comes out of the fact that we didn't think that mama or daddy would ever get sick, okay? And then when they do, and sometimes anger is involved. You know, you didn't let me know we were going to be here, okay? And so the African American community, we've had to maneuver a lot of disease-based factors very differently than other people. A lack of resources, the family being dispersed, a number of factors that have caused us not to be as effective as other groups in having the available resources available. And so we have some uniquenesses around how we maneuver and address major deteriorating diseases, and yet we hang in there, and sometimes we're not able to hang in there. So it's a conglomeration of ups and downs for us.
Yes, sir. No, and I like how you talked about the different parts, and and for me, I was almost seeing it as clues, and we talked earlier about you have to go on this search. Well, what would be some things or clues that people could see, let's say, in a loved one where they start to have that decline? Because in just from a personal sense, it wasn't this major drop off. It was I couldn't balance a checkbook, or I got lost, or it took me longer. What are some things from your perspective as an expert that you see are clues people could look for in their family members they're concerned about dementia?
So you mentioned a few of them. For instance, losing track of their finances. So if a family member is forgetting to pay bills, if they're paying bills like twice or three times and forgetting, that is a telltale sign. The other thing that I notice with dementia patients is wandering. And so they may exit the house and they just start wandering off. They may drive off somewhere. They may forget where they're going. There are a lot of reports to the police with, just dementia patients and people with mild cognitive impairment that just get lost, and your family members have a hard time tracking down where they went. The other thing that I notice is emotional changes. So there is a lot of paranoia in people who suffer from dementia because they're having a hard time piecing together what is happening in their environment, and they're also having a hard time consolidating those memories. And so when people approach them with some kind of level of concern, they become very suspicious of that person, even if they have the best intentions for them. I was the principal investigator in 2 NIH-funded trials that involved prediction of neurobehavioral disorders like dementia and epilepsy. And what we did is we looked at very common biological markers or biomarkers that you would typically see if someone went to the doctor's office just to screen for cardiovascular problems or kidney problems, right? So typically you go to the doctor and they'll measure your blood pressure, they'll measure your blood glucose, and they'll measure something called a creatinine level. And a creatinine level is a waste product and a byproduct of your kidney filtration system. And those markers are also highly important in predicting things like epilepsy and also specifically dementia. And you can repurpose these particular biomarkers, and what we're finding is there is certainly a connection between not just cardiovascular risk factors, but your kidney health as well. So that's another clue. If you yourself or a family member is going to the doctor, they're having these screening tests, some of these markers are, a little bit off, then that is a signal to really take care of the rest of your body. And this is through exercise, dietary interventions, and also primary care as well, which is very important.
Wow. No, I mean, that's fascinating that because I was going to ask, is there a risk score, right? Because for cardiac disease, and I hate to, I love to say it, we exist in an algorithm. It's either this or that. And then when you get to the next level, it's this or that. And that's why we can make decisions so quickly, right? Someone comes in, what's the EKG, what's the labs, heart attack, go to cath lab, open heart, right? That is literally how, maybe not that demonstrative, but it is that focus. Whereas to hear, a neurologist, which has to deal with the, hey, look, we got to search this out. We got to pull that together. Are there any risk scores or risk models or even imaging? Like, hey, can you do a scan and know? Because I know there are folks out there that might be suspicious, but, don't know what to ask their doctor to look for.
That's an excellent question. So I'm actually working to publish my findings, and I'm working with the Texas Kidney Foundation to develop an app and also a risk stratification system that we are going to publish soon. There's other things out there already that you can access, and one is called a PET scan. So it's a positron emission test, and it looks at your brain and different areas of metabolism. And so if there are low areas of metabolism in certain areas of the brain or certain lobes, then that would be correlated with dementia. And specifically, we look again at proteins, so it's an amyloid PET scan. That can help to measure your risk of Alzheimer's disease specifically. There are also blood tests and something called cerebrospinal fluid, where they do a spinal tap and take that fluid and take it to the lab to assess your risk as well.
Wow. I told you, cutting edge. I mean, we folks are getting it off the press today because that research hadn't been published yet. We got an app coming out, different things like that. But, I think it's good to hear the expert commentary. But Mr. Williams, I know you've had personal experience, both yourself and care. Did you, number one, see any of those risks, or when you think to those risk factors that they talked about, but then even in how you've been able to navigate and leverage that in your own situation, you mind sharing?
Well, responding to your first question, the things that we saw, as Dr. Musa pointed out, paying the bill 3 and 4 times, and looking at the statement and saying, wait a minute, what's going on here, and maneuvering through that. And also issues with space and time, not being able to manage that. And when I first started seeing certain behavioral characteristics express themselves, perhaps it's not really anything, it'll pass or whatever. And then you see the repetitive nature of those things. They begin to compile, okay? And then in the middle of a conversation, just stopping. And you waiting, you don't want to push the conversation, you're thinking perhaps trying to regain their thoughts. And go on to something else. And us trying to maneuver that, okay? And then my wife and I looking at each other and saying, you know, I think she's in a different place right now. And most important, learning the skills to accommodate that, to be able to respond, to redirect the behavior, to go along with what's being said, okay? Even though it's not being correlated with what you just said. You know, those skills. Because you had some very embarrassing moments, not so much for her, she's in a different world, but for us, you know, what do we do at this point? And realizing that while we have the love and want to give all the attention we can, there was a lot of things we didn't know, okay? We just didn't know. And the other part of your question?
And so in that, right, leveraging that tough situation, both you and your wife, and figuring that out, you had to overcome some personal challenges from a neurologic standpoint. If you wouldn't mind, that's why I said it, because I think there's this synergy that makes it challenging, right? If everything were perfect, okay, we can do this. But now I'm going to give you a neurologic issue that you have to work through.
Yeah, that's a difficult one.
Yes, sir.
Yeah, it's a difficult one. As far as the impact on me, I remember we had just opened up another restaurant.
Yes, sir.
And we realized that we weren't able to go and take care of the restaurant issues. We had to take her with us, you know, and we would place her in the restaurant. And sometimes we had to look, make sure she was, you know, in place. And from a neurological standpoint, it was daunting. It was, you know, it's just you asking me the question. It just shows that I still have some very deep thoughts about things that were not resolved. Okay, it's a difficult one. It really is. And while it's been a number of years, you realize that. And she was actually diagnosed with not only dementia, of course, that's the umbrella term, but she has Alzheimer. Okay, she had Alzheimer. And we were beginning to see going from the middle stage to the tertiary or the last stage. And that's where the inability to digest food, problems with, you know, how much food you put in the mouth, the size of it, because you don't want to ingest it or go into the lungs. I mean, we really saw some of the critical aspects of it. That hey, if you don't take care of this, you could be contributing to a more serious incident or moment.
Yes, sir. And now, Dr. Musa, we're going to shift gears a little. You touched on it, but one of the more common causes that, again, interrelates with cardiovascular health is vascular dementia. And that's different. Can you differentiate that from stroke? Because, again, me as a cardiologist, I say, oh, you've had some mini strokes that affect the processing, but I'm sure there's a more complex way to describe it and help folks understand it. But can you talk about vascular dementia, Mr. Williams? I know you wanted to touch on, you know, kind of stroke and that impact, but Dr. Musa?
Absolutely. So vascular dementia is different from, we'll say, Alzheimer's disease because of a stepwise decline. Alzheimer's disease may be preceded by mild cognitive impairment or neurocognitive disorder where maybe there's some short-term memory issues, but with vascular dementia, it may or may not be defined by stroke or TIA. However, there are some vasculopathies, meaning that there's arthrosclerosis, they may have plaque in their cerebral vessels as well. It's not really defined by a stroke. clinically speaking, there's just a stepwise decline. So they're functioning at a certain cognitive level, and then all of a sudden there's a sharp decline, and that sharp decline may involve even more memory loss. It may also involve attentional lapses, like you had mentioned with your wife. It may involve things like not being able to take care of themselves with activities of daily living.
Yeah,
And this
yeah.
is a sharp decline. And then over time, you get more and more of those sharp declines as well. Yeah, the thing that I'm very, very passionate about is neurorehabilitation. So in the field of neurology, there are ways to manage dementia, and these are all the different types of dementias that we talked about, and there are medications to help to slow the progression of dementia. But in addition to that, what I have been discovering is implementing programs that really prime the brain's ability to build new connections, and that is neuroplasticity. And neuroplasticity is simply the ability to form connections and to learn new things. A child can do it very easily. And we're also seeing in the field of cognitive science that it doesn't just end in childhood.
Wow.
So there are ways to help to bolster that memory in addition to the medications that we prescribe.
Well, I would be remiss, and I have to ask because I've experienced it from a very personal standpoint. Whenever I hear about any malady that is as horrific as some of the diseases are, the progress in the field, revolutionary research, new things that are happening. Can you share some of the latest findings or hopeful research area that gives us hope for the future and in eliminating some of these diseases?
Absolutely. So in our clinic, we implement, it's a multidisciplinary program. And so there are medications that have been out for a while, like for instance, Momentin or donepezil, that helps to slow the progression of Alzheimer's disease and other dementias. We also use something called neurofeedback, and neurofeedback helps to manage not just the psychosocial and emotional ramifications of dementia, but it can help to exercise memory as well. And the way that we do that is through a brain-computer interface. My background is in epileptology and reading brainwaves or EEGs. And so using this live recording of someone's frequencies or brainwaves, it trains that person through operant conditioning to prime the brain frequencies that are good for short-term memory and for executive functioning and planning. And then it reduces brain frequencies that are associated with some of the complications of dementia, like anxiety, for instance, depressive symptoms.
Yes,
And
yes,
overall, in this multidisciplinary approach, their quality of life, it improves quite a bit.
All right.
No, and again, neuroplasticity and various things like that are exciting pursuits. Now, I'd be, just as I'm a preventive sports guy, right? So,
Yeah.
what are some things people can do to maybe prevent? Let's just say
Yes.
hey, my mother had it, my
Yes.
father had it, or this, you know that you have that underlying family history or substrate, and you want to do everything you can to try to. What are some strategies to prevent, delay, and then maybe in some cases even eliminate
Yes.
dementia or various risks like that?
That's an excellent question. So I'd mentioned biomarkers that are associated with dementia, like high blood pressure. And what I found is that diastolic hypertension is something that is highly correlated with development of dementia later in life. This is something that we see a lot in the African American community as high blood pressure or hypertension. And so really screening and early detection is key. And so going to your doctor, even if you're in your 20s or 30s and there is history in your family of dementia or other cardiovascular risk factors, go to your doctor and measure your blood pressure. Just address it, and you would find there are many ways to naturally treat high blood pressure. For instance, abstaining from salt, reducing salt intake, increasing your activity levels and exercising. The other thing is diabetes, and diabetes is out of control in San Antonio, and hyperglycemia or high glucose levels are also associated with dementia as well. So again, lifestyle modifications and early detection. Don't neglect going to your primary care doctor and getting those things checked out.
Wow. I mean, and again, you encapsulated that so well. Mr. Williams, any commentary? Because I know you wanted to hear, we talked about cutting edge, neuroplasticity. Then we took it all the way back and said, hey, exercise, eat right, and watch your salt. Anything from your perspective that folks can take and or things that you've seen really impact, development or lack thereof?
Yes, I mean, the self-help. It's amazing how we deny reality and we'll call it something else, create a new euphemism. Being able to recognize the need to care for one another. The caretaker, if you're not together, then the patient or the loved one, all you do is contribute to a demise, speed it up, okay? And often it's very difficult. It was difficult for my wife and I to accept that, hey, we need a little time for ourselves as well. And, if you have someone that can assist in that process, other family members, whether or not be, just give you some free time, y'all go out for dinner and I'll sit with mother and take care of things. That's very essential. So you need to go to the well and be able to toss your own bucket in and pull up and say, hey, I need a renewal as well. And so that would be the one thing that I would advise and caution folk on. Take care of yourself. And that's a difficult one because we become sacrificial lambs often. That's mom. She's done so much for us. Well, she may be at the tail end of her life. And there's no need in you curtailing years of your life by doing something that's really not effective. And so self-recognition, self-support, and recognizing that the fragility of life is there. And I'm just amazed at all of the contributing elements that Dr. Musa pointed out that we can focus on. Cutting down on alcohol, smoking, toxicity in the environment. There's so many contributing factors. So it's enough to keep us all very busy.
Yes, sir.
And that would be my comment in summation of this tremendous condition.
Yes, sir. No, and it's and just to piggyback off that, it's almost like that airplane oxygen analogy.
Yes,
right?
yes.
Where you got to put it on yourself first before you try to
Before you-
reach out and
That's
give it
right.
to someone else.
Absolutely,
Right? And
absolutely.
I see that visually with that. Well, Dr. Musa, it has been a great discussion. You got me interested. I'm going
Thank you.
to learn as much as I can about, and I want to just do some neuroplasticity so I can relearn some new things. I think that's the other
Yes.
good thing about it.
Yeah.
But can you talk to people and tell them where they can find you, different programs you have available? Because I know people are going to be looking for you.
Yes. Well, you can find me at Kingdom Healing Institute or thekingheals.com. We're a neurology practice and we focus on neuroplasticity, building new connections, improving memory, and treating neurological disorders like dementia, stroke, Alzheimer's, migraine, and epilepsy. Again, that is thekingheals.com, and you can call us at 210-942-2055.
Wonderful. Thank you so much. And as we close out, I just want to say it has been great hearing about the problem, but now having a solution, whether that solution is reducing those cardiovascular risk factors, taking care of yourself, or reaching out to an expert. Individuals can do that knowing that at TAAN TV, we're providing those things to educate, empower, and also energize individuals to take back their life. As I mentioned, this is Dr. Batts with the About That Life podcast and my new collaborative partner, TAAN TV, the African American Network, speaking to you with another episode of Caring for the Caregiver. As you've heard, we brought in experts and individuals who really are impassioned about ensuring you have what it takes to care for those around you. But as we said, as it's on an airplane, you have to put that mask on first and really embrace caring for yourself, understanding that self-care is not selfish. As you look at the environment around you and make changes to those what we call modifiable risk factors, you can start to empower yourself to really embrace your health. As we move forward, we want you to understand that when we say life, we want you to truly live intentionally forever. Thank you for joining us, and we hope to have you back on the next episode of Caring for the Caregiver.
I got trouble